Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? I'm Steve Reiter, and Dr. Gladden, I was just at the Gladden Longevity offices a couple weeks ago.
Yes, you were, in the flesh. You walked in the door and said, hey, man, what's going on? Yeah, it's great.
So I got a, as you can still hear, I'm still dealing with this cough. We were on a call for the September Q&A, and you were like, Steve, you don't look well. And I was like, yeah, I'm fighting this lung infection. I got diagnosed with COVID and antibiotics. And you were like, you need to come down here and do some ozone. I'll give you the employee discount. I was like, all right. So I flew down there. Yeah. And talk about EBU, because I'm a raving fan now.
Yeah, well, EBU is very cool. It's a combination of filtration of the blood and an oxygen or a ozonation of the blood. And so that combination is really good at detoxing and stimulating detox. The filter takes out mycotoxins and some other things related to like Lyme, and doesn't really remove viruses like COVID per se, but it does do a good job of filtering the blood. And then the ozone is really good for rejuvenating mitochondrial function. It really shifts the whole NAD/NADH ratio, which actually enables the mitochondria to make more energy, which you need when you're trying to recover from something like this. And sometimes the mitochondria get stuck in a phase of reacting to a disease. So let me just explain this for a second. So when you get sick, everybody understands that they feel tired. Well, why do you feel tired? Well, it has to do with the fact that when an infectious agent shows up, the mitochondria tend to shut down ATP production because they don't want it hijacked for the benefiting of the bacteria or that sort of thing, or even the virus being able to make use of that ATP in the cell to replicate and things. So the mitochondria, which are usually kind of like cigar-shaped organelles, will actually fissure, and they actually go into little ball shapes, and they don't make nearly as much ATP, and so consequently you feel tired. And that's called a kind of a host defense reaction. And so the mitochondria are really the sentinels in the cell to actually tell when an infection is occurring. They kind of stimulate the nucleus to do things to make more antibodies and stimulate the immune system and all that kind of thing. But at the end of the day, you feel tired. And then what happens in like long haul symptoms, either related to Lyme or a COVID vaccine or any other mold or anything like that, is that the mitochondria stay in sort of this shutdown state, and they have a hard time. Typically, they go through about 3 or 4 stages to get back to normal function, but the mitochondria can get hung up and stuck. And so, and this is also true for kind of like some of the chronic inflammatory diseases. It can happen there too. So like fibromyalgia and things like that, people have low mitochondrial function. They're tired all the time. So what we've found is that using EBU, which again helps to detox people, but then using the ozone to actually help reboot the mitochondria seems to really work. And sometimes it takes more than one therapy, but that's been a real kind of game changer for treating people that are suffering from that. So yeah.
Well, I told you beforehand, before we started recording, that I could clearly tell my body was detoxing.
Mm-hmm.
And is that normal?
Yeah. It just depends on what's going on, right? So it tends to detox different people in different ways. I've done it a number of times and never had, what Steve was describing was that he felt like his bowel movements, for lack of a better word, were basically
stank to high heaven.
Yeah, so they were more toxic, if you will, like he was really detoxing. When I've done it, I haven't done that, but of course, my life is so clean and I'm so perfect that, right. So that's right. But other people report that as well. So yeah. But one of the really key things in life is this detox, and it happens when we fast. It happens when we do saunas. It can happen when we do plasmapheresis, which I just did yesterday. It can happen when we do EBU, things like that. So yeah, these are important things to do because we're just inundated with junk, right? Either in the air, the water, plastics, all this stuff. So yeah.
And then I also did the ozone sauna.
Oh, nice.
And describe that one for the listener.
Well, the
What it
ozone
does and
sauna,
what are the
yeah, there are
benefits?
different ozone saunas on the market. This one happens to be called a Hockett, HOCATT, and they're not cheap. They're around, the cheapest one's about $30K, and then they go up from there, believe it or not. But what they are is basically, it's kind of like a fiberglass tub that you get into, and your head is sticking out because you don't want to breathe ozone. Ozone's toxic to the lungs.
Yeah.
Right. But then you sit in the sauna, and it has steam, it raises the temperature, and it's different. You don't go up above, like you can get it to go up to about close to 50 degrees centigrade, but you're not up to like 180 degrees. The steam would be burning your skin if it was that high. So typically people do it around 44, 45, 46 degrees centigrade, which is probably, I'd have to do the math on it exactly, but somewhere around 112, 115, something like that. And then the ozone comes in, and you sit in there for between 20 and 30 minutes, and then you're actually absorbing the ozone through your skin. So with the EBU, it's actually being put into the blood by the device. With the Hockett, it's going through the skin, and then that stimulates a whole host of things, right? So ozone's amazing for reducing pain, reducing inflammation, accelerating healing. It represents an oxidative stress, so it upregulates your ability to handle oxidative stress. And then it also has this ability to change the NAD to NADH ratio and kind of reboot the mitochondria. So pretty cool.
Well, like I said, in the days afterwards, I felt amazing.
Yeah.
I felt like on top of the world, and
come on
I
down.
was crushing stuff. And I'm a big fan. How often do you recommend people do EBU?
If they have an ozone sauna, we recommend that they not do it more than twice a week because it is a hormetic stress. And you can overdo a hormetic stress, right? So people that are ultra marathoners, I mean, that's wonderful that they do that, but very few people are genetically built to actually do that. And so you can have lots of long-term health consequences from exposing yourself to oxidative stress, which when you're doing protracted exercise, you're building up more reactive oxygen species because your mitochondria are being asked to make all that ATP, right? So the exhaust of that engine is basically these reactive oxygen species. So anyway, with ozone, it's another oxidative stress, but you want to use it in a way that you're stimulating your system, but not trashing your system. So we think twice a week, if you did it on a Monday and a Thursday, or maybe a Monday and a Friday, or Tuesday and a Friday, something like that would probably be about right. But I wouldn't do it more than that.
That's the ozone sauna. How about EBU? Like
well,
yearly,
EBU's
quarterly, or is it?
Yeah, EBU's, you're hooked up, right? You have an IV in one arm and an IV in the other arm, right? Blood's going out, going into the machine, being cleaned, if you will, filtered, then ozonated and put back in. And it takes about an hour. And, it depends on what the condition is. So if somebody's really suffering, we could do that for them like, 2 or 3 days in a row, right? Really? If they're really, really suffering, or we could do it like once a week if they're, suffering pretty much. If it's a little more low key, we could do it every couple of weeks, every 3 weeks, maybe once a month. If you're doing it for general health, you might do it, once a quarter, something like that. So,
So coming down to Dallas and knocking out 2 or 3 treatments if needed, if somebody's really struggling, that would be something you might advise.
Yeah, if you're really struggling and you came in, of course, we need a phone call to kind of figure out what's really going on for you. But let's say that in fact was the case. If you came down and spent a week, right, you could maybe get 3 treatments done in a week, and that would be could be really a game changer. So, yeah.
Well, I'm a giant fan of it, and I highly recommend listeners consider going down to Dallas and meeting Dr. Gladden in person and meeting the team. I met a whole bunch of staff members that I've never talked to before because all I've talked to are, certain people regarding the podcast. And so I had a blast. I had an absolute blast down there getting to meet a whole bunch of new people. And
it's a nice office too. It's well laid out. It's comfortable.
And it's a great location between Love Field and DFW.
Mm-hmm. Yeah. It's easy to get to. So
super easy. You don't even need to rent a car. You can just do an Uber.
Yeah, exactly. Or just put on your jetpack, fly in. So,
So this month, it is Breast Cancer Awareness Month, Healthy Lungs, dental hygiene. And so we have a whole bunch of stuff plus a listener question. So we're going to start with this listener question. His name is Sam Dowler. His question is, my wife and I are planning to try for our first child in a couple of months. Are there any general recommendations you have to help ensure my wife is in the best health for herself and the potential baby leading up to and during pregnancy, i.e. certain food, supplements, habits, tests that we could consider doing or avoiding? Also, as a bonus, is there anything I can do as the male in the months leading up to giving us the best chance of creating a healthy baby? That would be, of course, great also. Thanks, Sam, for the question.
Yeah, perfect. Okay. So, the biggest recommendation would be have lots of sex, right? So that would be, and I don't mean that facetiously, because actually the more sexual activity that you have, the healthier your prostate is, the healthier your sperm count is. It's kind of like a little bit of use it or lose it kind of thing. And that's not only true for erectile function, but you kind of want to keep the factory humming, so to speak. So, having frequent sexual activity is always super helpful in this regard. When it comes to women, there's a number of different things that go on, and some of them are related to hormones, right? So, it's very important if women have PCOS, right, polycystic ovarian syndrome, where they basically have insulin resistance and elevated testosterones and things like that. It's very important that they control their blood sugars. And inositol has been shown to be very helpful in helping people with PCOS get pregnant. There's some special forms of inositol out there that are particularly useful. And I'm not here to make a specific recommendation. If you have PCOS, that's something you should talk about with your local doctor. But just know that inositol can be very, very helpful. And then controlling blood sugars, is very, very helpful. And so the other thing is, with regards to your hormones, having adequate levels of progesterone, really, really important in order to maintain a pregnancy. You have to have enough progesterone. So if you're struggling at all, getting your hormone levels tested and done, a few days before your cycle starts is typically a good idea to kind of get a feel for kind of where your general hormones are at. And then it's also possible to do a whole month of actually testing hormones every day to actually map your hormone profile. And if you're serious about getting pregnant and you're having some difficulty, that's a very smart thing to do, because then you can really sort of pick up what's happening. There's things, of course, stress is a big problem, and many things that release stress, like meditation and yoga and exercise and healthy relationships and sexual activity are important. It turns out that zinc is very important, not only for women, but also for men. We'll talk about that in a minute. You can get a lot of zinc from pumpkin seeds and lentils and whole grains. And then you want to be able to detox your hormones properly. And so the detox pathways are impacted by cruciferous vegetables, and that works really well. When it comes to supplements, you're probably all familiar that women take folic acid or folate. If you have an MTHFR mutation, then taking methylfolate is important. Vitamin D should be there, 1 to 2,000 units a day. Omega-3s are great. CoQ10 is great, maybe 200 to 600 milligrams. And then one of the really interesting things is iodine. So iodine's anti-cancer, it's pro-thyroid. But one of the interesting things is you can raise your baby's IQ by 10 points if you have adequate iodine levels. And there's really kind of a pandemic of low iodine, right? Because we all got away from using Morton salt. So using some iodine, we have some in the store, in the supplement shop. It's upgraded iodine, and it doesn't taste bad. You take a dropper full, every 3 days. And it will significantly kind of optimize your iodine levels. So about 150 micrograms a day is what that turns out to be. You can also get it from seaweed and using some Morton salt, iodized salt. But that's a real interesting one, right? If you're really trying to make your baby not only get pregnant, but make your baby healthy, that's a really cool one. And then having adequate iron, magnesium, And then obviously being able to stay away from toxins, right, which is almost impossible to do. But plastics, pesticides, maybe step away from synthetic fragrances, and soaps and skin creams that have synthetic substances in them can be helpful. And then regular exercise is great, right? So a lot of women will continue to exercise during their pregnancy right up until the last few weeks. Like I know runners that will run right up until about 3 weeks before they deliver. That running is really good for preparing their cardiovascular system for the stress of carrying the baby. So when you're pregnant, your blood volume goes up by not double, but it goes up by at least 50%. And so that's an extra load that your cardiovascular system has to carry. So being in great cardiovascular condition helps you more effortlessly carry the child. And of course, there'll be some shortness of breath and discomfort when the abdomen gets distended and, your diaphragm's pushed up and you can't get as deep a breath. But if you have good cardiovascular and lung function, it's going to make all that a whole lot easier. So I would say, start doing some cardio, maybe like 5 days a week even, and some resistance training a couple days a week to really get in shape. And then, of course, adequate sleep. So those would be some of the primary things to think about. For men, managing oxidative stress is important because it can damage sperm. So we like hydrogen a lot for optimizing oxidative stress, molecular hydrogen twice a day, which we have in the Gladden Longevity shop. And then, antioxidants like vitamin C and E and CoQ10. And one of the interesting things is that zinc, which was good for women, is also really important for men to increase sperm counts.
Really?
So, yeah. And here's another thing. We had a couple that came to us trying to get pregnant, and that wasn't happening. And we found out that the husband was sitting in the sauna. He loved the sauna. Well, it turns out that heat
during that time.
Heat kills sperm, right? So if you're trying to get pregnant, stay out of the hot tub, stay out of the sauna, things like that. You want to, the testicles are descended from the body for a reason, and that is to keep them a couple degrees cooler than core body temperature, because that's when optimal sperm production occurs. So you don't want to throw yourself into these heated situations, right?
Would you recommend then, maybe some cold exposure, cold plunges?
Yeah, I mean, you could do cold plunge. That's another sort of shock to the system, though, a little different. But I don't believe that's associated with decreased sperm counts, but sauna is for sure.
Yeah.
The other thing is you want to avoid exogenous testosterone. So exogenous testosterone lowers LH and FSH, and those are the two pituitary hormones that stimulate testosterone release and sperm release. So if you're taking exogenous testosterone by cream or injection, you're going to shut down your sperm production, right? So that's something to avoid. And then D-aspartic acid has been shown to normally enhance testosterone and enhance sperm count, which is interesting. And fenugreek, which has been used to basically control blood sugars, another supplement, also increases libido and supports sperm health. So that's interesting to know. Also, you should know that folate is good for you, methylfolate if you have an FTHFR mutation, healthy fats like omega-3s, and selenium from Brazil nuts can improve sperm motility. So selenium, zinc, if you had to pick a couple of these, it'd be hydrogen, zinc, selenium, maybe throw in some of the fenugreek and D-aspartic acid, folate. And then for you too, good regular exercise and significant amounts of sexual function kind of keep the factory working, right? And so all that's good. L-carnitine can boost sperm motility. Ashwagandha can lower stress, and maca has been shown to increase sperm count also. So those are lots of things you can do as a man to help to optimize. And those questions come up about rapamycin.
I talked with you about this beforehand. I think I remember reading it in Dr. Sinclair's book.
Yeah,
Lifespan.
there is some data around it. I'm not as familiar with it for sperm count increase. I'm kind of outside of the window where I'm really thinking about having more kids, but it is something that you could explore, and with rapamycin, of course, it's blocking mTOR, which has some rejuvenating factors, particularly when you combine it with things like spermidine, and boosting NAD. Those all work together synergistically So you could look at that. For me, that would be a little bit more of a second line kind of thing. I think most babies in the world are born without rapamycin being part of the picture, right? So I don't think it's really a frontline thing, but if you're really struggling, it'd be something to explore. And then you also want to avoid toxins and, as we said, avoiding heat. And both of you should probably quit drinking. Alcohol, it does improve sort of people's libido on some level, but it also decreases performance. And alcohol in general just isn't good for the health of your cells. So I would stay away from alcohol and tobacco and probably any other recreational substances. So those would be the thoughts that I would have.
Well, when you were talking about making sure to be careful about the soaps and lotions and makeup and all that, it reminded me of a website and an app called Think Dirty. And on that website and app, which we have no affiliation with, I just used it in the past to find some clean lotions and such. That would definitely be something I would recommend that be done to help with cleaning up that area. So thank you, Sam, for the email. And listeners,
and send us pictures of the baby.
Yes, absolutely. Send us an update. Be sure to email us at podcast@gladdenlongevity.com. That's podcast@gladdenlongevity.com. If you have any questions you are listening right now, you want Dr. Gladden to answer on next month's Q&A episode. All right, Dr. Gladden, it is Breast Cancer Awareness Month.
Yeah.
And we have a handful of articles here: breast cancer myths, breast cancer guide everyone should have, new tech for cancer screening, and a new way to kill cancer cells. So Dr. Gladden, I want to start with these myths and in this article about the myths, and I want to hear your answer to these myths. So myth number one is, I live a healthy lifestyle, I won't get breast cancer.
Yeah, that's a myth.
How so?
Well, there's so many risk factors for breast cancer, right? And just because you're living a healthy lifestyle, if you don't know your underlying genetics, or you don't know that if you have children at a younger age and breastfeed them, that you have less breast cancer and things like that. There's so many things you need to know. So yeah, I think that's a total myth. I mean, it's a good thing to do, but it's a myth that it's actually, and it does protect you on some level, but it doesn't preclude you getting breast cancer. So
myth number two, I don't need to worry about breast cancer if I have no family history of it.
That's also not true. Genes have different levels of penetrance, and quite honestly, not everybody knows their parents. This is interesting. In the age of adoptions and donor-conceived children, many of the donor-conceived children are never told that their social parents are not necessarily their biological parents. And so, it's not to say that this is, 1 in 10 families or anything, but you can't just base yourself on the family history. In this day and age, I think it really makes so much sense just to do your own genetics. Because even if every woman in your family has had breast cancer, and you do your genetics and you see, hey, you know what? I don't have any of those genes. You may have dodged that bullet, right? And just because, we see this, like families that everybody gets Alzheimer's, there's one person, they don't get Alzheimer's at all. They didn't get the same genes that everybody else got. So it's really important to do the genetics, I think, to understand what's going on.
All right. Myth number three is, if I have no lumps, I don't need a mammogram.
Well, if you're waiting for a lump, you're waiting for way too long. And, we could talk a little bit about my approach to actually thinking about breast cancer. The first thing you need to understand is that there's some genes out there that really do predispose you, right? So there's BRCA1, BRCA2. There's another gene called PALB2, PALB2, and there's another one called TP53 and another one called CHEK2. And it's important to, if you have any of these genes, to actually be doing really what we would call more regular screenings, right? So self-examination is important, but then the question becomes, well, what's the best way to screen? Is it going to be a mammogram? Is it going to be an ultrasound? Is it going to be a thermography? Is it going to be an MRI? And so it turns out that when you have any of these genetics, then hormone replacement therapy is probably not in your best interest, right? So estrogen many times will help drive breast cancer. Progesterone, not synthetic progestin, right? But actual bioidentical progesterone helps protect against most breast cancers. So you need to understand that as well. And then it's really important to make sure that your hormone levels are good if you do have one of those. And I think, quite honestly, that the MRI, if you can get that done, is one of the best ways to actually look for early cancer. Yeah. But even better than that is doing a circulating tumor cell test, which can pick up malignant cells before you ever have quote unquote clinical cancer. So if you have a strong family history of breast cancer and you're worried about this, I would do a circulating tumor cell test, just about every year, maybe starting from, age 25 or so. And there's a lab in Dallas here called Cancer Check Labs that I don't have any financial relationship with, but they do it. There's another lab in Greece called RGCC that also does it. And the prices between the two labs are pretty much the same. RGCC is more robust in their ability to give you more information about the tumor cells if they are found. And we tend to use that lab pretty frequently. And there are other tests coming also. But I think the circulating tumor cell is one of the best. I would never use Grail. Their data is so terrible. It's a question of whether or not they'll even be in business in a year, quite honestly. And we've never been fans of theirs. And so I would stay away from that. As if you've had that test done and you were told you don't have cancer, I would throw it in the trash, because their ability to detect stage 1 cancer is less than 10%, right? So that's almost useless. So I would not use that test for sure. Mammograms, they have some downsides with radiation to the breast, and people feel like that radiation damage can stimulate it. If you are going to get an x-ray to the breast or do a mammogram, I would drink hydrogen ahead of time. Yeah. Because hydrogen's been shown to decrease radiation damage. So I would take a couple hydrogen, throw it in some water, drink it down, go in and get your mammogram if that's what you're going to do. Ultrasound can be helpful. It's probably not quite as good as an MRI, which can see through, dense breast tissue and fibrocystic breast tissue and things like that a little more readily. So those would be some of the things I would think about.
All right. And then the final question, the final myth: remission means my cancer journey is over.
Oh, wow. No, not even. I mean, remission is it's remission. What we see in people that have had cancer is that many of them will still have circulating tumor cells, even after they're in quote unquote remission. And in other words, their PET CTs are negative and their MRIs are negative, and nobody can find any cancer in the traditional sense. But you have to understand that those tools are very, very crude. What I mean by that is the resolution of them is not that great. Like an MRI, is down to, 1 or 2 millimeters, right? Well, a tumor that's got 1 or 2 millimeters has billions of cells in it, right? So you still have cancer at that point, and it may be missed. The circulating tumor cells are a better way to look for this. And there's another lab that's coming online in New Jersey that's not available yet, but they have the ability to look for hybrid cells, which basically are a white cell combined with a tumor cell. And when you have those cells, they are a predictor of how long remission will last and what the survival will be.
What?
So you actually want to know what these hybrid cells, if you have hybrid cells or not, because if you're in remission, you want to track circulating tumor cells and hybrid cells when this becomes available. I had a call with them about 4 weeks ago now, and they still weren't quite ready. We'll make an announcement about it when they are ready, and people can start utilizing that lab. But I think it's a really interesting adjunct to the other testing that we do. So we're excited to be able to get a hold of that. There's also been a oncologist out of Colombia, Azra Raza, who has a biphasic antibody that's being used in a clinical trial. You'd have to be part of the clinical trial that can actually kill these hybrid cells, right? Which she thinks are really kind of the mother cells here. And if you take care of those, the cancer will not recur. So if you're in remission, it's not time to relax. It's time to actually say, okay, I've got a window of opportunity here to go after the remaining terrorists, so to speak. That's the way I would think about it.
All right. Dr. Gladden, there's also this article that our producer Leo sent about a new way to kill cancer cells.
Yeah, it's a pretty fascinating article, actually. And I'm seeing it in the context of this question. It's important to understand for the audience that a lot of the therapies that are designed to combat cancer focus on killing cancer cells, which of course sounds like a good idea. The problem with chemo and radiation, though, however, is that they're indiscriminate killers, right? And so there's basically a lot of collateral damage that gets done to normal tissues. And one of the tissues that really suffers from that collateral damage is the person's immune system. It's actually weakened. And what we know is that really in order to beat cancer, to actually be cancer-free, right? And that means having killed off the hybrid cells. It means there's no more circulating tumor cells. And to actually be cancer-free, it takes a very robust immune system to be able to do that. So in this article, they're talking about people with breast cancer, and some of them had triple negative breast cancer, which is very difficult to treat. This was an article out of London. And they identified a protein on cancer cells. And it's not just on breast cancer cells, but that's what they were looking at. And the protein is called RIPK1. And this protein enables the cells to basically escape detection by the immune system. And so they basically developed a new, let's call it drug, if you will. And it's an innovative technology. It's called proteolysis. And what happens is this new product called PROTAC, PROTAC, was used to basically cause the RIPK1 protein to undergo degradation, right? Which is what proteolysis is. It means to basically lyse or degrade a protein. So using PROTAC, they were able to, and this was done with kind of like next level drug discovery, if you will. They were able to use PROTAC to destroy this RIPK1, so rest in peace K1 protein. And when they destroyed that rest in peace K1 protein, what happened was the person's immune system was unable to identify and kill the cancer cells. So the beauty of this is that it's a therapy that enables the immune system to kill cancer cells. It's kind of like checkpoint inhibitors, right? Where you basically release the immune system from the spell that's been cast by the cancer cells to say that, hey, we're okay, and to activate that checkpoint and say, everything's okay over here. When the inhibitors come in and say, well, let's release the white cells and let them go after the cancer cells. So this is another kind of scenario analogous or similar to that, right? So I love this approach because what you're doing is you're making it tough for cancer cells, and you're boosting the immune system, and you're allowing the immune system to do what it really needs to do. So this is very, very cool stuff. Yeah.
Could this be tweaked at some point, do you see conceivably in the future, as kind of almost a preventative thing, or does it need to be targeted specifically towards that cancer?
Well, if you think outside the box, and right now I'm sure it's in very controlled trials and everything like that, you've got to have certain stages of breast cancer to qualify and all those kinds of things. But let's say you take it out of all those boxes. I could imagine that you could have something like this, and I don't know the side effect profile of it yet, right? That's always a question.
Yeah.
But let's say the side effect profile is minimal. You could have a situation where you're detecting circulating tumor cells and you're releasing this, right? And now you're actually killing those tumor cells. Now, it turns out that those hybrid cells, tend to be very resistant to almost every other therapy. So whether they're resistant to this or not, I don't know. But it may take a combination of something like this and something that targets those hybrid cells specifically to actually eradicate the tumor cells. But it's a really, really nice therapy. So,
what amazing times we live in.
Yeah, it's beautiful, right?
Wow. Wow. All right. This month is also Healthy Lungs Month. And so, Dr. Gladden, let's talk about lungs, especially because I've been dealing with this cough and all of that. So what are the kinds of things that you do to keep your lungs healthy?
Well, a lot of cardio exercise, right? A lot of cardio exercise. And I do 2-stage breathing when I'm doing my cardio exercise.
What is that?
So if you're exercising, just imagine you're running or biking or elliptical or whatever you're doing. Your lungs are your breathing is kind of along for the ride, right? I mean, you're just breathing, right? It's kind of like my legs are working, this is doing that, blah, blah, blah. But my lungs are just kind of along for the ride. What I was learned or was trained to do when I started wearing the elevation training mask was that in order to get, when you put on an elevation training mask, it's kind of makes it harder for you to get a breath in, right? You got to pull in harder and you got to blow out harder. Not only that, you've got extra dead space in front of you, right? So you've got to clear the air through the mask before you can get to fresh air, right? And so if you're breathing your normal way, you're not going to be getting fresh air. You're going to be stacking sort of stale air. And after about 10 or 15 breaths, you're going to want to rip the mask off because you're not getting any fresh air, right? Yeah. So it sort of teaches you this technique of breathing extra deep. And to me, when I don't have the mask on, it's kind of a 2-stage breathing kind of thing where you take that breath in, it's natural for the exercise, and then you take in that extra to kind of fill your lungs completely. And the beauty of that is it's really engaging your diaphragm and your intercostal muscles to pull that air in. 2, the reward for that extra effort is much bigger than the effort because all of that air that you're pulling in at the end is essentially dropping to the bottom line of gas exchange, right? So you've got a whole tree to fill, right? You've got a mouth, a throat, a pharynx, a larynx, you've got a trachea, bronchi, all the branches of the tree that go down to the leaves on the tree, which are the alveoli. That's where the action occurs. That's where the oxygen is basically delivered to the hemoglobin and the CO2 is released. And so when you take in that extra breath, that second stage of the breath, you've already paid all the overhead. You've already filled all the dead space. Now that extra air just goes down, if you will, into the alveoli. And so you get a big gas exchange. So you can find yourself doing a heavy exercise where normally you'd be out of breath. If you're doing 2-stage breathing, you can actually do that without even, breathing more slowly than you would otherwise, just because of the efficiency of breathing. So I think training yourself to breathe like that and doing cardio exercise, strengthening the diaphragm, intercostal muscles, using an elevation training mask, maybe 2 or 3 days a week for 15 minutes, all that stuff will really help build lung function. So that's, or at least breathing function, the bellows effect of the lung, right? So that works really well.
What are your thoughts about specific breathing techniques like Wim Hof or
those are
box
different.
breathing? And
those are different. Those are really designed not so much for lung health, although they have a benefit of lung health. They're more built for the effects of changing the pH of the blood, right? When you're doing Wim Hof breathing, you're basically hyperventilating, right? So you're changing the pH of the blood and you're making it more alkaline, and that has an impact on the brain, right? So the brain is sensitive to the pH of the blood, and when you're doing that, blowing off that CO2, then it can put you into a different state where the neurotransmitters are working differently. It can almost be like a deep meditative state, or he used it actually to kind of cure his depression from when his wife passed away, because it will release more dopamine into the system, just like cold plunges were released more dopamine. It's one of the reasons that Wim Hof started, hiking in the cold with just a pair of shorts on, or getting into, ice baths and things like that, right? And training himself to breathe, to be able to maintain that. And yet at the same time, the real reason he did it was to change the neurotransmitter release in his brain, right? So pretty interesting. So those box breathing and things like that, those are good for meditation and things like that. It's not so much to build lung health per se, right? If you really want to build lung capacity, you're going to be doing cardio where you're breathing much deeper and harder and engaging more muscles, if you will. But those are great forms of breathing to help augment meditation and things like that. So
one of the articles that Leo provided was titled, "For people with lung cancer, exercise can be grueling, but evidence of benefits is growing." What about you when you see someone that has lung cancer? What are the kinds of things that you're doing?
Yeah, well, we don't see a lot of lung cancer here per se, but every study that I've ever seen shows that people that have cancer that are able to exercise do better.
Really?
Yeah. And I don't think it's just a selection process. Like if you have a group of 20 people and they can all exercise, they can all walk a mile or whatever it is. And 10 people start doing that and do it on a daily basis, and the other ones, just kind of live their life. The ones that walk a mile a day will definitely outlive the ones that don't, right? It's pretty dramatic. So exercise is, I think, critical, not only in heart disease, but in cancer as well. You never want to give up exercise. I mean, sometimes you get to a point where you simply can't. I understand that, but there's almost always a way to do something, right? Mm-hmm. And so I've had some injuries where I couldn't do this or I couldn't do that, but I always found a way to do something. And I think it makes a big difference.
Another article that Leo sent was from Parade Magazine. One habit pulmonologists are begging people with severe asthma to adopt ASAP. That habit is actually taking your medicine. But one of the things that they said in here is another habit that they hope people adopt with asthma is exercise.
Yeah. Exercise. There's exercise-induced asthma, right? And so that's an interesting thing. And there's also cold air-induced asthma. So if you live someplace where it's cold and you go out for your walk or run or bike or whatever you're going to do, snowshoe for that matter, sometimes using an inhaler ahead of time, like some albuterol, to kind of help dilate the airways can be helpful. But even there, it's so great to exercise. There's never a downside to exercise. Sometimes you have to adapt to be able to exercise, but ultimately you're actually improving lung function. One of the things that happens for people with asthma, chronic bronchitis, people that smoke, of course, have big issues. People that smoke have chronic bronchitis. They're breaking down not only the alveoli where the gases are exchanged, but the walls of the bronchi get weaker. And so they can get air into their lungs, but when they basically exhale, and you can just do this yourself, just take a breath in and push out, you'll feel that push. Well, the airways collapse because they've lost their structural integrity and they have a hard time getting air out of their lungs, right? So if you're exercising all the time, you're helping to maintain the integrity of all the structures in the lungs, right? Even if you're a smoker, right? This is going to sound weird, but if you're a smoker, you should be running more than most people, right? To try to maintain some semblance of lung health. So,
Well, it is also Dental Hygiene Month. What are your thoughts about dental hygiene? What are the kinds of things you're doing besides brushing and flossing?
Yeah, I mean, brushing, flossing, we have some testing that we do, oral DNA, to look at the DNA that populate the mouth. And I think that's very important to know if you have bacteria there that can be associated with dementia, heart disease, cancer, insulin resistance, as well as gingivitis, right, or gum disease. You kind of want to know what's in your mouth. So oral DNA is a good test to do to actually see that. And if you find it, you can actually eradicate those bacteria from your mouth with some ozone treatments that are done by a functional dentist. They can put ozone on some, basically some cotton swabs or however they do it, and sort of pack your mouth with it. And it actually will heal up your gums and get rid of the bad stuff that's there. The other thing to realize is that you don't want to be using mouthwashes like Listerine and things like that kill off all the bacteria, because those really strong mouthwashes, they also kill off the good bacteria that you need to be able to make nitric oxide. So people's blood pressure will go up when they're using mouthwashes. And
I remember,
because
I
they don't
think, I
have
think it
enough
was on our
nitric oxide.
conversation. I think it was on our conversation with Dr. Nathan Bryan where he was
It
talking
is, yeah,
about
with
that.
Nathan Bryan, right? That's right. So you want to avoid those those kinds of mouthwashes. There are some healthy ones out there that, and we have one in the supplement shop that is safe. We've actually tested it. You can use this mouthwash, and it does not impact your ability to make nitric oxide. So if you go to it's called Dental Sidon, and Dental Sidon toothpaste they make also, which is healthy for your bacteria also. But I think, it's more than just brushing and flossing. It's about thinking about the bacteria that populate your mouth and realizing that they can cause gum disease. The other thing, not only gum disease, but systemic disease. The other thing that's really important is there are some oral probiotics that you can take that will actually support the good bacteria in your mouth. And we have some of those as well in the supplement shop.
Probiotics.
Yeah. Interesting, right?
Yeah.
So, yeah, you kind of suck on them, right? And it kind of does some things to help the oral bacteria that you want to have there sort of thrive. The other thing that happens is people that have had root canals have a significantly shortened life expectancy.
What?
Yep. And it has to do with the fact that because they don't have a nerve under that tooth anymore, many times they can have a latent infection down there that's causing systemic inflammation. They don't know about it because there's no pain. So if you've had root canals, we recommend people to replace those with, an implant, basically. And you can figure out whether you have a latent infection there or not by having a CT scan of your mouth done at the dental office. They do a kind of a CT of the mouth. And so we think that's important also. You want to basically make sure you don't have these latent infections. So gum disease, right? Ozone therapy, mouthwashes, the right mouthwashes, CT scans, some regular dental hygiene, right? Cleaning your teeth, things like that. All that's important. And then you don't want to go to bed having eaten sugary things and then go to bed without brushing your teeth, right? Because the bacteria will be working on that sugar all night and kind of eroding your enamel on your teeth and causing cavities. So, yeah.
All right, Dr. Gladden, there's another article that Leo had sent. Dental hygienist talks about how to spot periodontal disease by smelling your floss after you use it. Apparently she went viral on TikTok, and so I want to hear your thoughts about this.
Well, yeah, if your gums are bleeding when you floss, then you've got gum disease, right? If you have a lot of anaerobic bacteria there, then anaerobic bacteria don't smell good, right? Whether it's in your stool or in your mouth. And so it's just a way to kind of give you some insight into that if you need more insight than just the fact that your gums are bleeding. So,
well, for listeners, in the show notes, there's also an article from the Huffington Post about a toothbrush that apparently has super thin bristles, 10x thinner than most other bristles, and it helps to get in between your gums. I actually put it in my cart. I was like, what the heck? It's like, I think it's 2 toothbrushes for around $10. And so I'm going to give it a try.
Yeah, cool. Yeah. Send me a link. I haven't tried it. Send me a link. I'll try it too. We'll report back.
All right, Dr. Gladden, that is about it for the day. What's new and exciting at Gladden Longevity that you want to talk about, or things that you're looking forward to?
Man, everything's exciting here. So some of the rejuvenation procedures have gotten really, really incredible. I had an accident with on my elliptigo, which is like an elliptical on wheels. I got cut off suddenly when I was riding it and kind of flew off it, quite honestly, and landed on my right knee. And I had torn the ACL on my right knee when I was about 29 or 30 skiing. I've never had it repaired because it's never really been that big of a deal. But anyway, the knee really kind of shut down on me. I could barely walk upstairs, and I couldn't walk downstairs at all. And then, it was getting a little bit better. I was doing a little bit of some laser on it and some other things. But then we did this new procedure where we basically took some of my plasma and heated it up to a particular temperature to basically create kind of a matrix gel, if you will. And then we put that into my knee. We put some hyaluronic acid in there. And then we basically took some more of my plasma, spun it down, activated the PRP fraction, which has these VSELs in it, very small embryonic-like stem cells, and put all that in there. Now we've been using some peptides. Anyway, all that went in, and then I think we put some ozone in it at the same time. So my knee felt fairly full. But
Yeah.
This was last week. This was last week, Thursday. So on Wednesday, I was limping around like super gimpy. On Friday, I was doing just about anything I wanted.
Wow.
Yeah.
Wow.
That quickly. It was so dramatic. And I went mountain biking Saturday, and I went mountain biking on Sunday. And on Saturday, I rode a really hard trail that I haven't ridden in a long time. I just wanted to check it out. It's as hard as I remember. There's some really steep, rocky drop-offs where it's just like, I don't think that's really in the cards for me today. And but you have to walk down it, right? And with that knee, I was able to walk down it just fine. And I'm like, wow, this is really dramatic. So, so being able to rejuvenate things, whether it's your skin, whether it's your whole body with the plasmapheresis, and we have access to some additional products from Wharton's jelly, cord blood, and placenta that are incredibly rejuvenating, particularly when you combine them with, activated PRP or other stem cells. And it's phenomenal, quite honestly. So, if you're sitting there suffering with something, chances are we can help you significantly with it. Now, if you need a surgical, you need a bone chip removed, or you need something sewn back together, that's what you need. But apart from that, it can be dramatic. So we're really excited to see. Also, my meniscus was a little messed up on an MRI scan I did a few weeks back. And so I'm trying to see if we can actually rejuvenate that also. So I'll keep you posted on that, but pretty exciting, really. So
awesome.
Yeah.
Well, again, listeners, if you want to send us a question, go ahead and send it to podcast@gladdenlongevity.com. That's podcast@gladdenlongevity.com. That link for that email will also be in the show notes. And Dr. Gladden mentioned 2 supplements in the supplement store, iodine, and then what was the other one that you mentioned? It was the
I mentioned hydrogen.
You mentioned hydrogen,
upgraded iodine. I mentioned dentalcidin.
The dentalcidin, that's what it was.
Yeah, that's the mouthwash and the toothpaste.
And if you use the code podcast10 when you go to gladdenlongevitysshop.com, you'll get 10% off your order.
Yeah, exactly. We also have selenium and zinc and all those kinds of things in there too. So, and methylfolate we have great B vitamins and all that sort of thing. So yeah, good stuff.
All right. Thank you, Dr. Gladden. We'll see you next month.
See you next month.